Honourable members, instead of taking questions, we move to item number 5, dealing with statements. And we have the Honourable Minister for Health in the House to brief the Honourable House on the Phase 1 Ebola Vaccine trial in the Volta region. Honourable Minister, you have the floor.
Right Honourable Speaker, I appear before this august House in response to your summons to brief Parliament on the Ebola vaccine trials in Ghana. The summons, Mr. Speaker, followed the statement by the Volta caucus on the floor of the House in which it expressed some reservations on Ebola vaccine trials in the Hohoi district of the Volta region. While the concerns may have been specifically related to proposed trials in the Hohoi district, there is no gainsaying the fact that the issue has assumed a national dimension, and understandably so, given the fear and trepidation that the Ebola disease causes in all of us. Mr. Speaker, the outbreak of the Ebola virus, EVD, last year caught Africa, indeed the whole world, unawares and totally unprepared. It traumatized and decimated many communities in fellow West African countries, namely Guinea, Liberia, and Sierra Leone. Mr. Speaker, at the height of the epidemic last year, African leaders, and especially leaders of the ECOWAS sub-region, made urgent appeals to the international community and the World Health Organization in particular to assist not just in relief of operations, but more importantly, in finding a cure or vaccine for the dreaded EVD. His Excellency John Dramani Mahama, our own hard-working president, who was at that time chairman of ECOWAS, provided inspirational leadership, helping to garner international support to deal with the epidemic. Ghana became the operational base of the international relief operations, and President Mahama even took the bold decision to visit Ebola-stricken West African countries as an expression of deep concern and manifestation of brotherly love and human solidarity. Mr. Speaker, in response to urgent appeals from leaders in our sub-region and the cries of all our people, the WHO rallied around pharmaceutical, research and development companies that had prospective candidate medicines and vaccines, some of which were administered at trials on medical personnel who had contracted the disease while working as volunteers in some disease-stricken areas in West Africa. Mr. Speaker, in October 2014, the World Health Organization facilitated a meeting of the African Vaccine Regulatory Forum in South Africa to consider how to accelerate the process of approving prospective candidate medicines or vaccines. Given the urgency of the situation, participating countries agreed to undertake joint reviews of clinical trials applications in order to reduce the time usually taken to process applications. The final decision as to whether to approve clinical trials or not, however, rested with the regulatory agencies in individual countries. Mr. Speaker, subsequent to the meeting in South Africa, the WHO wrote to regulatory bodies of Ghana and 4 other West African countries, namely Nigeria, Senegal, Cameroon, and Mali, notifying them of the intention of GlaxoSmithKline, one of the world's leading pharmaceutical companies, to submit a candidate vaccine for clinical trials in our respective countries. The World Health Organization subsequently convened a joint review meeting in Geneva on the 14th and 15th of December last year, which was attended by a number of international health regulatory bodies, including Health Canada, Swissmedic, European Medicines Agency, and the U.S. Food and Drugs Administration. Mr. Speaker, following the Geneva meeting, GSK submitted an official application on December 17th to the Ghana Food and Drugs Authority for authorization to conduct clinical trials. In February 2015, the FDA received another application from Johnson & Johnson to conduct clinical trials in Ghana. Similar applications were made to Kenya, Tanzania, and Uganda by Johnson & Johnson. The FDA derived its mandate from the regulation and approval of clinical trials from Part 8 of the Public Health Act of 2012, Act 5851. Indeed, since 2004, the Food and Drugs Board, as it was then known, has built capacity to regulate and monitor clinical trials in Ghana. Mr. Speaker, it is very important to note that since 2004, the FDA, or the FDB for that matter, has dealt with 54 applications for clinical trials, out of which 43 were approved. The other 11 applications were not approved due to insufficient evidence of safety and efficacy. Out of the 43 approved clinical trials, 14 were for various types of vaccines, 26 were for drugs, and 3 were for medical device trials. I hasten to add that most of the clinical trials conducted in Ghana over the years have been at Navrongo, Kintampo, and Hohoi. I will come to this later. Mr. Speaker, it goes without saying that the FDA monitors the clinical trial research centers and performs pre-trial inspections of sites to ascertain suitability and capability for particular trials. The FDA has had cause in a few instances to take regulatory action, including suspending trials, imposing fines, warnings due to non-compliance of good clinical practice, and regulatory requirements under Act 851. Mr. Speaker, owing to the enviable capacity with which the Ghana Food and Drugs Authority has developed over the years, it was nominated by the WHO to host and assist its counterpart organizations in Sierra Leone to review a protocol for phase 3 of an Ebola vaccine trials by Janssen, which is a subsidiary of Johnson & Johnson. The meeting was held in Accra from 8th to the 10th of April 2015. As recently as June the 9th, 2015, Ghana FDA provided similar advisory and capacity building support for a pending phase 2 Ebola vaccine trial for Burkina Faso, La Côte d'Ivoire, Kenya, and Uganda. Indeed, it may interest you to note, Mr. Speaker, that the Ghana Food and Drugs Authority has been designated as a regional center for regulatory excellence with oversight responsibility for clinical trials as well as medicines evaluation and registration in the sub-region. As I stated earlier, the first application received for Ebola vaccine trials in Ghana was in December 2014. The sponsor was GlaxoSmithKline. This is a phase 2 clinical development trial with safety and immunogenicity in healthy humans in Ebola-free countries as its main objective. Mr. Speaker, please permit me at this stage to venture into the world of biological science. Hesitation. The vaccine for the proposed GSK trial is an Ebola glycoprotein gene. According to scientific information available to my office, when the vaccine is injected into healthy humans, antibodies against the Ebola virus will be produced, which can lead to the prevention of EVD. The vaccine, according to the information available, cannot cause EVD since it does not replicate in humans due to the deletion of its replicating gene. For the avoidance of doubt, this vaccine does not contain the Ebola virus. This vaccine does not contain the Ebola virus and therefore cannot cause the Ebola disease. Countries involved in the proposed phase 2 trial of the GSK vaccine are Ghana, Nigeria, Cameroon, Senegal, and Mali. The rationale for conducting the trial in Ghana and 4 other countries takes into consideration the fact that these countries border the affected countries. The design of the phase 2 trial will be such that, in the event of an outbreak, persons already vaccinated would be already protected. Mr. Speaker, the Kintampo Health Research Center and the On-Sciences Chemotherapy Research Center, HOHOI, has been proposed by the sponsors as prospective trial centers. Proposed by the sponsors. Right Honorable Speaker, we however have information that phase 1 studies of the trial vaccine have been conducted with different dosages of the vaccine to assess its safety and immunogenicity in humans. These studies were conducted in the National Institute of Health, Bethesda, Maryland, USA, Oxford University in the UK, Center for Vaccine Development in Mali. The application by GSK is under consideration. Nigeria, I repeat, Nigeria has, however, given approval for the trials. The Janssen Ebola vaccine trial. Right Honorable Speaker, the second application received by the FDA was from Johnson & Johnson. Incidentally, the principal investigator selected by the sponsors is no less a person than our own Professor Binka. He won a competitive bid to conduct the study at his research site, which is in the Volta region, HOHOI to be specific. Mr. Speaker, permit me to give a brief history of the HOHOI Center and why it has become a focal point of clinical trials in Ghana. The Encore Research Center at HOHOI was started in 1986 by the World Health Organization. For nearly 30 years now, over 30 clinical trials, including phase 1, phase 2, and phase 3 studies of onco drugs, malaria drugs, and others have been conducted according to international recognized standards at the HOHOI Center. The current use of ivermectin and other combination of drugs recommended by the World Health Organization for all the onco-affected countries was developed following trials at HOHOI. The research center has collaborated with more than 20 reputable institutions, including the World Health Organization, UNICEF, the Noguchi Memorial Institute for Medical Research in Accra, the University of Ibadan, the National Institute of Health in Maryland, the Liverpool School of Tropical Medicine and Center for Global Health and Diseases, Case Western Reserve University, USA, to mention but a few. Mr. Speaker, HOHOI is an internationally recognized name in clinical research. The contribution of the Kintampo and Navrongo research centers are also well documented. The clinical trial phase 1 of the Janssen Research and Development subsidiary of Johnson & Johnson is to assess the safety and tolerability of its vaccine. There are 2 vaccines involved, a prime and a booster vaccine, the combination of which provides protection against the virus. Mr. Speaker, as I stated earlier, the countries to be involved in the proposed phase 1 trial by Johnson & Johnson are Ghana, Kenya, Uganda, and Tanzania. And the decision to use the center in HOHOI for the Ghana clinical trials was made by the principal investigator. I have sought to provide as much information as possible so as to give the honorable members and good people of Ghana enough insight into the issues of the Ebola vaccine trials that has generated so much discussion. Mr. Speaker, Part 8 of the Public Health Act 851 of 2012 does not ascribe any specific role to the Ministry of Health where clinical trials are concerned. I believe the framers of the law did so in order to isolate matters of a scientific clinical nature from political control. Nonetheless, in the case of the Ebola vaccine trials, a different approach was taken, bearing in mind the intense public fears of the Ebola disease. In this respect, at the very onset, the FDA duly notified the Ministry of Health as soon as applications for the Ebola trials were received. And here I refer to the application from GSK and Johnson & Johnson. It is on record that my predecessor and the Deputy Minister were both briefed by the FDA. The Deputy Minister was actually assigned oversight responsibility to monitor the process. On my assumption of responsibility barely a month ago, I facilitated 2 roundtable meetings precisely on the 4th and 10th of June 2015, which were called to discuss some concerns raised by some senior scientists and researchers. Indeed, Mr. Speaker, the FDA governing board, concerned with public sensitivities surrounding the Ebola disease and fears that clinical trials of vaccines could generate among Ghanaians, and conscious thus of the need to be proactive, set out a plan for stakeholder engagements preceding any formal approval for Ebola vaccine trials. Mr. Speaker, I must concede that implementation of the program for stakeholder consultation and community engagement has not been as thorough as one would have expected. Consequently, I took the decision to announce the suspension of commencement of clinical trials to allow for adequate time to reach out and assure all concerned that under no circumstances will the ministry or the government, for that matter, approve any clinical trials that will undermine the health and safety of residents of Hoho in the Volta region and the people of Ghana as a whole. Mr. Speaker, I have noted the ongoing debate within the scientific community on aspects of the Ebola disease, including possible origins and vaccine trials. That ongoing debate is what drives scientific pursuits and discoveries. What is of immediate importance is to build safeguards for vaccine trials, even as we are guided by history. It is our enlightened self-interest as a country to contribute to the global quest for an Ebola cure or vaccine. Mr. Speaker, there are various ongoing studies and trials on Ebola in many places around the world. There's one study, for instance, involving 59 people, which began last November in the US, Canada, Germany, and Gabon. We are told the vaccine was developed by the Ghanaian government and is licensed to 2 US companies. The US National Institute of Health has also reported that an Ebola vaccine is being tested in Maryland, in the USA. Surely, Mr. Speaker, it will be sad to describe all those participating in the quest to find an Ebola vaccine or cure in other parts of Africa and in the distant places of Europe and North America as guinea pigs. Mr. Speaker, from the foregoing, the following conclusions can be drawn. 1, Ebola is still a major public health, social, and economic threat to West Africa in particular, and Africa and the world in general. Until the last case of Ebola is found and dealt with, there's still a clear and present danger of spread. The epidemiological history of Ebola in East and Central Africa points to the return of the epidemic, even if this current wave is overcome. It will therefore be prudent for all of us to do our part to find permanent medical solutions in the form of vaccines and medications to overcome Ebola and to minimize its adverse effects. Ghana has led efforts in West Africa to fight and defeat Ebola by the examples of our president visiting the 3 affected West African countries to break their isolation on the 15th of September 2014. His Excellency the President's speech on the 25th of September 2014 at the United Nations calling for the world's support and attention and the hosting of UNMIR in Ghana. Finally, Mr. Speaker, let us remember that Ghana has contributed 42 health workers to the African Health Workers cadre that went to the 3 affected countries to assist in fighting the disease. We have had to do our bit to support the development of a safe and efficacious vaccine against this disease. Firstly, because we will potentially be the greatest beneficiaries when the efforts are successful, as Ebola is now in West Africa, and also because the problem is now our West African problem, and we, more than most, should be concerned about finding a solution. Mr. Speaker, I believe Ghana has the intellectual capacity, infrastructure, and track record to support such a clinical trial, with demonstrable strength in governance institutions like this august House and the Ministry of Health, regulatory mechanisms like the FDA, and implementation and research with numerous health research centers throughout the country. For every clinical trial, there are potential risks. So we have to take that into account and make every effort to identify the risk early and abort the trial if need be. That is why the FDA had put in place extra measures over and above the usual measures they employ to make sure that in the event that this trial is to proceed, things do not get out of hand. Mr. Speaker, it is clear from the debate in this august House and from reactions from Ghanaians as a whole that there's some misunderstanding about the trial, the dangers it poses and its benefits to Ghana and the rest of the world. Ebola evokes fear, and discussions about the disease are emotive. Clearly, Ghanaians are in general, and the communities within which the trials have been planned were not sufficiently consulted and briefed about the trial. In order for this to be corrected, I am proposing the following steps. 1, a nationwide public education program will be initiated to sensitize the Ghanaian public on the nature of vaccine trials against Ebola to remove the misconceptions and suspicions. The sensitization program will begin on Thursday, 18th of June, 2015 in Accra, 2 days' time. It will afford members of the general public and the media the opportunity to interact with professionals on clinical trials. We would hope that all views will be discussed at these forums that are going to be organized, in order that a total objective position can be obtained. The venue and time will be communicated by the end of the day. But, Mr. Speaker, even before the sensitization starts, let me state categorically that the trial has not started anywhere in Ghana. Let me also state that we have not even given any approval for the importation of any such vaccines. And let me further state that no volunteers have been recruited for any proposed trials. Indeed, the selection of volunteers in itself is a very rigorous process with a long drawn-out protocol and safeguards. It actually involves an exam. Mr. Speaker, this sensitization program will, as a matter of urgency, be extended to the Brong and Hafo, Volta, and Upper East regions, which will usually host clinical trials. That was point number 2. Finally, point number 3, Mr. Speaker, with your permission, I will proceed to facilitate a meeting between the Parliamentary Select Committee on Health and the experts at a time that will be convenient to members of the House. Following that interaction, I pray that the Select Committee will subsequently brief the House on its findings. Finally, Right Honourable Speaker, the Ministry of Health, under my leadership, will do what is right. We will do what has to be done to make sure that the good people of Ghana are protected. We will do what is right to ensure that in the medium and long term, Ghanaians are safe from emerging diseases such as Ebola. Thank you, Mr. Speaker.